We all probably remember back to dental school, or maybe even run into this in your private practices, is having to present the patient with several different treatment plans ranging in price. One which may be the best for the patient, but then one that may be clinically acceptable, but it costs a lot less. And then you always have to couple what you want to do for the patient versus what they can pay for. And we all went into dentistry wanting to do the best we can for our patients. Well, the Air Force really makes that possible because you don't give patients several different treatment plans ranging in price. You give the patient one treatment plan that's best for them.
The opportunity to work on soldiers injured over in Iraq, it's been extremely rewarding. They actually come to us after being stabilized intra-theater and will come to us for secondary reconstructions. And that's probably been the most rewarding part of my Air Force career.
Another amazing aspect of the Air Force is that every clinic is a group practice environment. Now by that I mean you're not going to be by yourself making decisions on patients' treatment plans. You're always going to have colleagues down the hall who may be general dentists, who may be periodontists, prosthodontists, or endodontists, who you can bounce things off of.
So this is what's called a stereolithography model. It is created based on a CT scan of the patient's head and neck, and it is made out of acrylic. Well, the benefit is you can actually see exactly what you're going to be working with in the OR, as well as it saves a lot of intraoperative time and energy because you can pre-bend all of your reconstruction bars, plan the distractor placement, or even treatment plan how long of a rib graft you'll need for a particular patient.
One of the best aspects of an Air Force practice is how many opportunities there are for continuing education. In the civilian world, we all know that we have to do so many CE hours a year. Well, the Air Force makes that whole process very easy.
Each year, you will have the ability or opportunity to attend a meeting or class of your choice, and it's fully funded by the Air Force, as well as if you feel like your skills or knowledge base is deficient in one field or one specialty or the other, you can come to Lackland Air Force Base and partake in anywhere from a 2-week to a 6-week short course, which is a very intensive training within each specialty, and they fly all the specialists in that field from all over the world to teach you for that period of time.
If you want to come in the Air Force and you want to treat patients, you want to experience new things all the time, you want to use the best technology, you want to provide world-class care without regard to a patient's ability to pay, then this practice environment is definitely for you.
The Air Force offers you lots of opportunities to further your education, to take courses that interest you and courses that apply directly to the job that you're in.
The NTP program, which is Nurse Transition Program, is a program that the Air Force has for new graduate nurses or nurses that have less than a year experience. It lays the foundation for new nurses. It teaches a nurse what to do, what to expect on the floor, so they can transition to their new duty station and be able to function when they get to that floor.
The difference between working civilian versus Air Force is civilian, the nurse to patient ratio is a lot higher. Sometimes I'll have up to 7 sick patients, and you may have 1 CNA to help you out. It's a certified nursing assistant, and you're basically on your own. In the Air Force, we have
med techs that work with us. They don't work for us, but they work with us on our team. And pretty much what they do is those busy tasks, things like AccuChecks, things like weights, things like blood pressures, vital signs, things that the nurse is not always able to do because she has a patient load.
You can help each other out effectively and do more effective patient care that way.
As a nurse, you're the one that takes care of the patient, so you're there with the patient all day long.
When you work with the doctors there, it's working professional to professional. You're not looked down upon.
So they respect your opinion. You're an advocate, and the doctors do listen to you.
As an Air Force nurse, when you first commission out of school, you're making about the same amount as you would if you're working civilian. From there on, as you promote and the more years you have in, you end up making more than a civilian nurse.
They give you your pay and allowance. After the pay allowance, you have housing allowance. Civilian hospitals don't give you a housing allowance.
You receive full medical benefits for yourself.
It's a family environment. You go in and you know who you're going to be working with. We have a set schedule. You know who's going to be there for the day. Just teamwork. It's just a big team, and it's a big family.
You know, everyone's proud of me, all my friends, family, and I just think that being an Air Force nurse, you're just held to a higher standard.
Ever since I was a small child, I had a lot of respect for people who served in the military and helped make this country what it is. And it's a really fantastic place to be, and a lot of people paid a big price to help make it the way that it is. And I felt that that was something that I wanted to do in my life, was to be an officer in the military, and in particular the Air Force. And it wasn't that it was something that I expected to make a career out of. It was just an aspect of my life that I wanted to give to the military, and it was something also that the military was going to give back to me.
My friends will probably tell you that I am not your typical military type, and they were extremely surprised when I decided to go to the military medical school.
I could have gone to medical school and done residency in Louisville, Kentucky, gotten a job in Louisville, Kentucky, made a very good wage in Louisville, Kentucky, but I would not have seen and done all of these fantastic things that I've done to this point with the Air Force, and I wouldn't trade it, not for anything.
I have been paid a base salary as an active duty captain in the Air Force. In addition to that, I have my housing allowance, my subsistence pay, and a specialty pay for being a physician.
My wife and I, we have 4 children. Our 4th was born in Germany.
In the Air Force, I know that there's a unique opportunity to travel to all different parts of the world.
We traveled all over Europe. We went to Africa. We went to the western portion of Asia and to Turkey, and we went to England and Spain and Italy and the Czech Republic and Hungary and Poland, and we traveled all over Europe and had some wonderful experiences there.
As an Air Force physician, number one, going on a humanitarian mission has personal rewards. The reward that you are doing something to help out somebody in need. And that's always a common altruistic character that I think all physicians have.
I know that the military will cover the patients, and they ask me to deliver the best care that I can. And so I'm not concerned about whether or not their insurance will cover a therapy that I recommend. I'm not concerned about telling a patient who has fibroids that you need a hysterectomy, or I recommend a hysterectomy, and the military coming behind me and saying, no, you can't do a hysterectomy, it costs too much. And so I've never felt that I've been restricted by the Air Force in the care that I deliver to patients. And it's something that I appreciate, being a physician and feeling like I have that autonomy to do what I think is best for the patients, or to recommend the care that I think is best for the patients.
Everything that the Air Force has given to me up until this point, and all of the benefits that I see in the future for both me and my family, are beyond what I could ever give back to the Air Force. And so I'm in it for life.
I was diagnosed with colon cancer at the age of 35, January 18th, 2005, and it was the last thing I expected. And then here I am on the other side of it as a patient with something such as cancer, and I didn't hesitate for a second. I wasn't worried about it. I didn't need a second opinion. I didn't need to say I'm getting my care out in the civilian practice, because to me it wasn't a question. I knew those people, I trusted those people, and that's where I was going to go. And I'm very thankful that I did. They took care of me from start to finish.